Okay, so because I pretty much thought that you would ask what the most important skills are for being a good nurse, I jotted a few down. Okay, so because not everybody is a good nurse, but there are certain characteristics, qualities that you need to be a good nurse. So I would say I wrote down some of the most important ones. The first one is good communication. You have to have the ability to listen and understand the concerns of the patient. You have to be able to evaluate conditions and be able to create treatment plans that are unique for each patient. So good communication skills are really vital to being able to do that. You also have to have a really good attitude. You're walking in a lot of days with patients who are on some of their worst days and do not have good attitudes, and you have to help turn that around. You also need to have good teamwork. A nurse is the most important liaison between the patient and all the other people who are caring for this patient. You have the doctors, you have case managers, social workers, consulting physicians, speech, OT, physical therapy. The nurse is the central person that's kind of tying all those people together. So it's critical for you to be able to communicate the needs of the patient and what the treatment team is planning for that patient. Good critical thinking and problem solving skills are also important. Professionalism, of course, speaks for itself. Good conflict resolution. A lot of times there are issues that arise with the patient where the nurse has to really look for ways to advocate for the patient to have the best patient experience. And finally, the most important thing I think a person needs to be a good nurse is to have empathy. Try to be able to put yourself in the position of that patient and try to understand how that patient feels, what they're going through, and really advocating for their best patient experience. With regard to the schooling that's involved to become a nurse, there's lots of So there are several different types of degrees you can get to become a nurse. One is a licensed practical nurse. That's the first level. Then you can get an associate degree. You can work your way up to a bachelor's or a master's degree. With each degree, it requires more schooling, more experience, but it also so with each degree comes obviously more experience, but also the ability to advance and make more money and hold higher positions. So it just depends on what it is you want to do. So the main reason I decided to become a nurse is because I truly love taking care of people. I've always loved to take care of people. I've always been interested in health and wellness and trying to help people to not only be the best people they can be, but nurture them when they're sick or going through difficult times. One of the other reasons I chose to be a nurse is because it's a career that has a huge degree of flexibility and offers a wide array of environments that you can work in. You can do anything from behavioral health, hospice nursing, working in a nursing home. You can work on a surgical floor, medical floor. You can be a travel nurse. The opportunities for different places that you can work are endless. It offers good pay. So the pay can be excellent because you get paid hourly. You can work as many hours or as few hours as you want. It's a great career for somebody who has a family or other obligations outside of their work because, like I said, you can work as many hours or as few hours as you like. Post-pandemic, there's a really great demand for nurse right now. People are offering huge bonuses and incentives and rewards for people to come to work for them. So there's just a lot of great opportunity, I think, in the nursing field. So I've been a nurse just shy of 10 years at this point. When I graduated from nursing school, I took a job in behavioral health. So I worked on both an adult and a pediatric psych unit. I got great experience in working with behavioral health patients, which is a really unique clinical base. So I appreciated that experience. Then I went from there to gain experience in a medical surgical unit. So I went to work at a hospital. in Wilmington, where I started out on a surgical floor. I worked with post-operative patients. So I dealt with a lot of wound and dressing care, pain management, that type of thing. And then I moved from there to a medical floor, took care of patients that just had different medical issues. And so after that, we relocated here to Columbus, Ohio, and I got a job at Riverside working on an intermediate patient floor where I dealt with caring for a lot of more critically, more acute patients that were more seriously ill. I took care of patients on ventilators, things like that. So that gave me a new area of experience. And then I went from there to just recently working at Dublin Methodist Hospital. I work on the medical unit 3 there, which again has been a great experience. All these things have given me a multitude of different skill sets that I think have all made me a better nurse, the nurse that I am today. So I don't think I mentioned this before, but one of the big reasons I decided to become a nurse is because I have actually had personal experiences with nurses that I don't think empathized at all with my situation that I was going through. So I think the most important thing that I do every day when I go to work is to not only empathize with my patients and really make them feel like I'm caring for my own family, but also to advocate for them and to make sure that everything they have or everything they need or all their questions are answered. And if things aren't going the way they would like for them to go, I make sure that we do whatever is necessary to make their experience the best experience it can be. Probably the other thing I would say is working with actively dying patients, patients that are dying, dealing with their family, and just making sure that they have a death with dignity. That's not only a really challenging thing to do, but it's one of the most important things I think a nurse has in their careers, to make that experience the easiest experience that it can be for a family, because it's one of the most difficult times. So those 3 things, just having empathy, advocating, and just helping patients that are in really difficult times in their life, just making sure I can do the best that I can for them. Yeah, I think probably the biggest piece of advice I would give is to definitely, before you start nursing school, get some kind of experience working in a healthcare environment. Work as a CNA, work in some sort of admin environment, but just get experience working with patients, because nursing definitely is not for everybody. I know a lot of people who have started in on it and realized, like, hey, this isn't for me. So just getting that experience prior to starting nursing school. Secondly, I would say that just not to give up. If you are in nursing school, it's going to be really hard. They do that for a reason, because nursing is not an easy profession. But if you are dedicated and devoted to becoming a nurse, do not give up, because it will happen. Lastly, I would say most accredited hospitals do require a Bachelor of Nursing. So I would say if you are in school, it would be in your best interest to go ahead and go for that Bachelor's of Nursing rather than doing LPN or associate degree, because you're going to end up having to go back to get it anyway. So those would be the things that I would offer to people who are looking to become a nurse. Thank you. I appreciate you taking the time to interview me and to see nursing as a really important job, because it is.